My name is Chanda Burns, and I'm a nurse practitioner student with MVU University. Today I'm going to complete my head-to-toe assessment. My volunteer today is my friend Naomi. Prior to this, we did the far vision test using the Snellen chart, and we did the near vision test using the Rosenbaum chart. I also did a full set of vitals, including height and weight, which were all normal. I had her empty the bladder and put on a gown. I did assess her gait as we came over here, and it was normal. I didn't see any balance problems, and she got over here with no issues. So I'm just going to do a general inspection of Naomi. She appears healthy for her age. She's dressed appropriately for the season and the weather. I'm going to do a general inspection of the skin. I don't see any bruises or rashes on the arm. Check the leg for any bruising or rashes. I'm going to go ahead and check for edema here in the legs. There is none, no edema in the feet. Skin integrity is intact. I'm going to go ahead and look at the skin of the chest. Skin is intact, no break in integrity. Overall, her skin looks very good for her age and ethnicity. I'm going to go ahead and start with the head. I'm going to visually inspect the head. It appears to be normal and round. I don't see any obvious nodules or masses or lesions. Just going to check both sides here. I'm going to go ahead and palpate the scalp and the skull. Scalp moves freely. I don't feel any masses or nodules or lesions. The skin is clean and shiny, and the texture is normal for ethnicity. It's black and long. I'm going to run my fingers through to see if the hair follicles move out easily, which they do not. Do not see any signs of alopecia. I'm going to go ahead and inspect the eyebrows. The hair of the eyebrows are evenly distributed. I don't see any masses or lesions in the eyebrows. As well, the eyelashes. I don't see any masses or lesions in the eyelashes. I'm going to palpate the eyebrows. The hair is smooth. Do not notice any, feel any masses or lesions. And the eyelashes, they contour outward, and they contour up with the upper lash and down with the lower lash. I'm going to go ahead and palpate the facial bones. If at any time you have any pain or tenderness throughout the assessment, let me know. I'm going to palpate the facial bones. Okay. I'm going to palpate the sinuses. We're going to do the frontal sinuses, maxillary, and nasal sinuses. Okay. I'm just going to use my pen light, and I am going to inspect the eyes. And I'm just going to check the conjunctiva, make sure they're pink and moist with no extra dryness or tearing. Checking the lacrimal gland, I don't see any abnormal drainage. The sclera is nice and white, no signs of jaundice, no masses or nodules noticed there either. The eyelids are also smooth, I don't see any masses or lesions there. I'm going to do a couple of tests with the eyes. First, we're going to do the cover-uncover test, so I just want you to focus on the spot of the wall. I'm going to have you cover one eye and then uncover, and then we're going to do the same with the other eye, okay? Uncover. And what I'm looking for is any nystagmus or strabismus, any extraocular jerky movements that are abnormal, which I did not see any. Now I'm going to do direct and consensual. I'm going to check the pupil constriction directly and consensual. The other eye, direct and consensual. Okay, now we're going to check the eye field. All six, we're going to check those. I just want you to follow my pen light. You don't need to move your head at all, okay? She was able to focus, no extraocular movements were noted there. I did want to mention that the eyes are symmetrical for position and placement. And we're going to move on to the ears. I'm just going to go ahead and inspect the ears. Gonna look behind, see if I see any obvious masses or lesions, which I do not. Any pain when I palpate. The auricle moves easily and freely. The position of the ears are appropriate. The pinna of the ear lines up with the outer canthus of the eyes. They are not too low set. I'm going to do now a couple tests with the ears. I'm going to first do the Weber test. I'm going to strike the tuning fork and I'll place it on top of your head. You let me know if you hear the sound in your right, left, or both ears. Very good. And now we're going to do the Rin test. I'm going to strike the tuning fork and we're going to put on the mastoid bone and tell me when you do not hear the sound. I'm going to move it to your ear and again tell me when you do not hear the sound. We'll go ahead and do the other ear. Placing on the mastoid bone. Very good. Now I'm going to look inside the ear, and I'm looking for any extra cerumen or anything that may be occluding the ear. I'm going to make sure that the hair is evenly distributed. I don't see any lesions or masses. The tympanic membrane is pearly and gray. Then check the other ear. Hair is evenly distributed, no excess cerumen, no lesions or masses, ear is patent, and the tympanic membrane is pearly and gray. Okay. The nose is midline in the face. Let me go ahead and move to the nose. I'm going to palpate. Let me know if you have any pain. Okay. Now I'm just going to look inside the nose with my pen light here. You hold your head up. I'm going to look at the septum, make sure it's not deviated. Also to make sure that the turbinates are not enlarged. Hair is evenly distributed. I don't see any abnormal drainage. Okay. Now we're going to check the patency of each nostril. Can you occlude one nostril for me and breathe in with the other? And the other one? Any problems with that? Very good. Okay, now we're going to move along to the mouth. So I'm going to test the lips, make sure that they're full, that I don't see any cracks or fissures on the actual lips, on the creases of the mouth, and that the spine is appropriately moist. And I'm going to look inside the mouth now. Open up for me. And I'm inspecting the buccal mucosa to make sure that it's pink and moist, no sign of lesions. I am looking at the hard and soft palate, no signs of lesions there. I'm also going to go ahead and inspect the teeth to see if there are any missing teeth. Make sure that there are no teeth that are broken, no discoloration, no foul odor. Also going to check the bottom of under your tongue, see if I see any lesions. Check for any suspicious lesions that could be indicative of oral cancer. So look at the tongue, it's pink and beefy. I'm also going to have you say ah. The uvula is midline. Also the tonsils are not enlarged. I'm going to go ahead and check the gag reflex. Okay, and it's intact. I'm going to do a series of tests with the face to check the cranial nerve. First, have you puff out your cheeks, smile, raise your eyebrows, squeeze your eyes really tight, and clench your teeth for me. Okay, let me have you stick out your tongue and move your tongue side to side, and that was all symmetrical, so that checked out for her. I'm going to have you clench your teeth, and I'm going to check the temporal mandibular joint. Any pain? Open the mouth for me and close. And I didn't feel any popping or clicking, so any pain when you did that? Okay. Alright, so we are going to move along to the neck here, and I'm just going to inspect. I did a general inspection of the skin. It was intact, no break in skin integrity. Neck is midline, don't see any deviations. I'm going to go ahead and palpate the pharynx, it's midline. Palpate the thyroid gland, it's smooth. Remove it. And swallow. Okay, it's smooth. No enlargement noticed or no signs of goiter. I'm going to check for jugular vein distension, which I don't see any. I'm just going to check this side. I'm going to inspect the carotid pulses to see if I see any pulsations or thrills, which I do not. I'm going to palpate the carotid pulses one at a time. Pulses are 2 plus and symmetrically. Now I am going to go ahead and move down to the chest. And I'm just going to inspect her breathing to see if she has any use of accessory muscles, any nasal flaring, any problems breathing at all, which I do not see. Just going to look at the anterior to posterior diameter, and it's 1 to 2, as it should be. Now I'm just going to palpate the chest here. Any pain? I'm going to go ahead and palpate the lymph node. Rear auricular, post-auricular, occipital, submandibular, submental, tonsillar, cervical chain, post-cervicular, deep cervicular, and pseudo-cervicular. And those all feel normal. Any pain under that? Okay. Now, I inspected the chest. I palpated for any pain. I'm also going to inspect for any thrills, heaves, or bruits. I did already inspect to make sure that her breathing was appropriate, no nasal flaring. I'm just going to palpate the scordium for any heaves or thrills or bruits, if there is none. And I'm going to go ahead and feel for the apical pulse here. Okay, and there's no deviation, which could be indicative of a heart. I'm going to take my stethoscope and I'm going to auscultate the carotid arteries with the belted stethoscope. And I'm going to go ahead and auscultate the thyroid gland. And I'm going to use the diaphragm of the stethoscope and I'm going to listen to her breathing. Deep breath for me. I'm going to listen bilaterally and compare. I'm also going to listen to the lateral aspects of the lungs. Okay. Now we're just going to listen to the heart sounds. We're going to start with the aortic, the right second intercostal space. And then we're going to listen to the pulmonic, tricuspid, third point, and the mitral valve. S1 and S2 were audible. I didn't hear any abnormal heart sounds, no murmurs noted upon auscultation. So now I'm just going to look at her arms and just inspect those symmetrically. Make sure that the musculature is symmetrical in both arms and hands. Going to check for capillary refill in the fingers. Make sure that it's brisk and that capillary refill is less than 3 seconds, which it is. I'm going to go ahead and check the toenails for capillary refill. And make sure that it's also brisk and less than 3 seconds, which it is. And there's no edema noted in the legs or the feet. Okay. I'm going to do some range of motion with your neck. So let me have you turn your head from right to left. Put your ear to your shoulders. Okay. Head forward and backwards. And I'm just going to apply resistance to each of those. Okay? So. go ahead and do the resistance with the arms. And your legs. And also your feet. I'm gonna go ahead and palpate your pulses. So I'm gonna start here with the brachial. Make sure that it's symmetrical. Gonna move down to the radial. The poplite's still behind the knee. The Dallas pedis on top of the foot. And the tibial. While I'm here, I'm going to go ahead and check your reflexes. So we're going to start with the brachial. I'm looking for movement in the hand. Radial. I'm going to check the knees, just let go swing. And Achilles right here behind the ankle. Okay. Alright, I'm going to have you turn around. I'm going to inspect the back. Okay. So the skin of the back is, there's no break in integrity with the skin of the back. I'm going to just assess her breathing again. It's symmetrical, no use of accessory muscles. I'm going to check for thoracic expansion. I'm just going to put my thumbs here. I'm going to have her take a deep breath, and I'm going to make sure that my hands lift symmetrically when she breathes. Okay. Deep breath for me. Okay. Fine. And now I'm going to apply indirect pressure to the costovertebral area here. Let me know if you have any pain. And that might let me know if she has a sign of a kidney infection. Okay. Now I'm going to check for diaphragmatic excursion. I'm going to percuss, and I'm going to move up until I hear a different sound in the resonance, and then I'm going to come back the opposite direction, and I'm going to measure the distance between it. It should be 3 to 5 centimeters. Okay. Mark there. Mark there, and that's within parameters. And normally you would do both sides, but because of time restraints, we're just going to do one side. I'm going to go ahead and percuss here the intercostal spaces, and I'm listening for resonance, hyperresonance, dull, and tympany. And we're going to go bilaterally. I'm going to have you turn around again so I can percuss the interior chest. And lateral aspect. Any hyperresonant sound could suggest abnormalities within those spaces. Okay, so now we're going to lay back and we're going to do the abdominal assessment. So I'm just going to inspect the abdomen for contour. The skin integrity is intact. I don't see any masses or lesions. The skin is smooth. I don't see any abnormal movements or thrills. So with the abdomen, we want to inspect first, then we auscultate, percuss, and then palpate. That's the order for the abdomen. So I inspected the abdomen. I'm now going to auscultate the vowel sounds in all 4 quadrants. I give myself 2 to 5 seconds to hear any activity. If I don't, I'll listen up for 2 minutes. If I don't hear anything, that could suggest maybe a bowel obstruction. And I'm also going to auscultate the arteries, the aortic, the renal, the iliac, on opposite sides of the umbilicus, and also the femoral. This is the renal, left and right, iliac, left and right, and the femoral, left and right. This is to the bow down. Valve sounds are active and appropriate. I'm just going to palpate for the aortic. Now I'm just going to do a light palpation here. I'm going to palpate generally across the abdomen, see if I feel any masses or nodules. Let me know if you have any pain or tenderness. I'm also going to palpate the right side for the liver and the left side for the spleen. I'm going to start with the light palpation. Okay. I'm gonna backtrack a little bit and percuss here around the liver border. The sound will be dull over organs, and it will be timpani over air-filled area. And I'm going to go have you turn over on your side, and I'm going to percuss for the spleen. And I'm just going to feel to see if I can palpate the spleen. I'm going to take my left hand here, and then my right hand and kind of cuff. And I can't palpate that. That's good. That means it's not enlarged. And then I'm just going to do finish up with the light palpation here. And then I'm going to do a deeper palpation. And I'm going to feel again over here around right side for the liver. And it does not appear to be enlarged. Okay. So I'm going to have you sit up. And I'm just going to have you stand up. And turn around. I'm going to check some spine and cervical. Any pain? I don't see any bones that appear to be protruding. It's midline. Can you bend over for me? I don't see any signs of scoliosis or kyphosis. Alright. And have you turn around towards me and just squat check the musculature, the leg. Okay. Alright, and I have one more thing I need to do on the abdomen. I want to check your abdominal muscles. So I'm going to have you lay and lift up for me. And I can palpate the abdominal muscles. Okay. So I believe we have concluded our test here. We did our head-to-toe assessment. She appears to be healthy. No complaints at this time. Thank you for your time today, Naomi. Thank you.